approach. ठीक है sir? So before going to any syndrome, first you should know individual bacteria. যেটা তোদের the problem you are facing, that you are not understanding the microbiology, like how to read it. তো বইতে যেরকম ভাবে রয়েছে, এক একটা বইতে according to NNC guideline they have set difference in. কথা বলিস না বাবা, টাইম কম, ফটাফট শেষ করে নিতে দে, তারপর কথা বল। এক একটা ব্যাকটেরিয়া it takes 2 hours. Your class time is very limited, so we have to finish it fast. So Staphylococcus is the first bacteria we will start with today. Okay. So there are 2 divisions of coccus family. Gram-positive cocci. There are 2 divisions. One is Micrococcaceae family and one is Streptococcaceae family. Okay. Difference between these 2 family. Their family. Okay. These 2 family are Micrococcaceae family is catalase positive. Okay, and Streptococcaceae family is catalase negative. What are the 5 Micrococcaceae family? We can differentiate into 4 species or 4 genera. Those are Staphylococcus, Micrococcus, Pneumococcus and Stomatococcus. Okay, and Streptococcaceae family we can differentiate into Streptococcus and pneumococcus and enterococcus. They all are catalase negative. Difference between these 2 shape হচ্ছে Staphylococcus Micrococcus family, this family round shape. They are shaped and we find it in clusters. In practical class I have shown you in Gramston class enterococcus, how are they in short chains or oval shaped gram-positive cocci, not totally round. Okay. So the name Staphylococcus, how does it come from? Where does it come from? In Greek, Staphyl means bunch of grapes. Okay. And coccus means berries. So berries are what color? Berries are what color? Remember Gramston, gram-positive. So if we see a cluster of bacteria which is color like berry is deep purple color. So gram-positive cocci we get in deep purple color. So that is how we remember Staphylococcus. Do not get confused in exam between Staphylococcus and Streptococcus. First difference is one is catalase positive, Staphylococcus is catalase positive, Streptococcus is catalase negative. Okay. So this is the history. Robert Koch first found the, who was Robert Koch? Bhule gechish? Introduction. There is no time, go and read it. Louis Pasteur ki korechilo first time? He cultivated. First time found the bacteria, discovered the bacteria was Robert Koch. Louis Pasteur, what he did? Culture media. Okay. And Sir Alexander Ongston, I don't know how to pronounce it. He named the bacteria. Okay, some Greek guy. So this is the thing. These are the types of, we can differentiate. How do we classify Staphylococcus in different categories? So based on pigment production, this is Staphylococcus aureus, which is 90% found in 90% of any infection caused by Staphylococcus species. Okay. So why it's called aureus? Aureus means which gives green color, golden yellow color pigment. Okay. If there is a good culture plate, I will show you it in your practical class. Okay. Golden yellow color pigmented colonies. Staphylococcus aureus, it gives albus. Albus means white. Okay. So it gives white colonies. And Staphylococcus citrus. So albus means albinism, you know the disease, albinism. Albinism, you know the disease. What is this? What is the difference between vitiligo and albinism? Who had vitiligo? He died to get rid of it. Michael Jackson. মরে গেলে ভুলে গেলে হবে লোকটাকে, লেজেন্ড একটা। So and citrus means any citrus means lemon, any citrus food. So citrus, it gives lemon yellow color. Okay, so based on pathogenicity and again based on coagulase reaction. So based on pathogenicity, Staphylococcus aureus is the most dangerous one. Okay, why? We will come to the virulence factor. What is virulence factor? Virulence factor, pathogenicity and clinical. See, for each bacteria we will teach you, these points will come. Number one is virulence factor, second is pathogenicity, means what is the virulence factor means কি জন্য ইনফেকশনটা হচ্ছে, কি জিনিস আছে which is causing the infection, and pathogenicity means how they are doing, how these virulence factors are causing the pathogenicity inside a human's body. Then we will come to the clinical features. Okay, then later on lab diagnosis, microbiology aspect থেকে যেটা দরকার হচ্ছে lab diagnosis. After that treatment এর জন্য for this particular bacteria how do we do antimicrobial sensitivity, and after next হচ্ছে drug resistant. Okay, bacterial drug resistant ডক্টর কুমার জ্যোতি স্যার পড়িয়েছেন। ব্যাকটেরিয়াল জেনেটিক্স এর সাথে ড্রাগ রেজিস্ট্যান্ট একটা ক্লাস হয়েছে, একটা অফ ক্লাস হয়েছে। ওকে ফাইন। সো another thing is coagulase, based on coagulase production. This is important. Why? Coagulase, Staphylococcus family is divided in coagulase-positive and coagulase-negative. Remember the difference between catalase and catalase is different. So we first differentiate Staphylococcus and Streptococcus. একটা ব্যাকটেরিয়া দেওয়া হলো, দুটোই জিপিসি মনে হচ্ছে। First you have to do catalase to differentiate it from Staphylococcus to Streptococcus. If the catalase positive holo, next you do coagulase test. If it is a coagulase test positive, coagulase test, catalase test কি করে করে? Catalase test, how do you do it? I told you, if the bacteria has a catalase enzyme, if any bacteria has catalase enzyme, then peroxide, hydrogen peroxide, okay, কি বলেছিলাম স্লাইডে, 1 ড্রপ হাইড্রোজেন পেরক্সাইড নিয়ে একটা ব্যাকটেরিয়াল কলোনি ইয়ে দিয়ে তুলে, কভার স্লিপ দিয়ে তুলে ওই এটার উপরে রাখলে there will be effervescence. Why? There will be release of oxygen. So Staphylococcus can do that. Both coagulase positive and coagulase negative Staphylococcus can do that. Okay, coagulase test differentiates between coagulase positive and coagulase negative Staphylococcus. It is a differentiation between Staphylococcus species. Okay, so what is coagulase positive? Example of coagulase positive is Staphylococcus aureus. Example of coagulase negative is Staphylococcus epidermidis, Saprophyticus. There is another one, Lugdunensis. Okay, and another one is Hemolyticus. Okay, they also cause severe infections. Nowadays emerging, when after the end of your microbiology session, we will come to the emerging and re-emerging diseases. So in the emerging diseases, you will get to see coagulase negative infections, how they are increasing day by day. Okay, so next slide is morphology. I told you about the morphology. This is a gram-positive cocci. Each cocci measures from 1.5 micrometer in diameter. Why this diameter I am mentioning? If I get a chance in a practical class, I will show you the colony and the smear, everything. It when you stain it, sometime Micrococcus and Staphylococcus, they look alike, but the difference is Micrococci family. Micrococci, I told you, Staphylococcaceae family is differentiated into 4: Micrococcus, Planococcus, Stomatococcus and Staphylococcus. In this, Micrococci is a skin commensal, or you can find it anywhere. Planococcus, Stomatococcus is not needed for you because they don't cause any kind of infection. Staphylococcus is important. Difference is Staphylococcus we find this. In this case, Micrococcus we find like this, a bigger one, exactly like this. 4 in tetrads, we see in tetrads, in gram stain. So this is how we can differentiate. You can tell me, man, this is also looking in cluster. But I'll show you in practical class if we get a chance. So this is how we differentiate between Micrococcus and Staphylococcus. Okay. So that is why the diameter is important. Okay. Then next is regularly grape-like shape, and the third point, they are non-motile, non-sporing. Some of them are, few strains are capsulated. Okay. But we do not see in a normal gram stain the capsulation of the Staphylococcus family. So this is, what agar is this? No Baba, what agar is this? I am asking, what is this? What is this place? Plate. একই রকম দেখতে colorless plate কি হয়? Colorless plate. Nutrient, agar, and আর কি হয় একই রকম দেখতে? Muller-Hinton agar. I told you both look same. Okay. Muller-Hinton agar er difference ki from in each class, whichever class I will take, I will tell you these points again and again. Exam e giye bhul bolbi na. MHA আর এর মধ্যে difference কি? Muller-Hinton agar and nutrient agar, they look same. Muller-Hinton agar এ কি করা হয়? Antimicrobial sensitivity test করা হয়. Nutrient agar এ what we do, it's a basal media. ঠিক আছে, basal media, solid media to reproduce any bacteria or for a subculture of a bacteria, because it is giving nutrition to the any bacteria which is dying almost, it is giving nutrition to that. Okay. So it is giving golden yellow opaque colonies with smooth glistening surface in diameter. So you have to write this thing, colony characteristics in lab diagnosis. I am going from backwards to frontwards. Okay. I am starting from lab diagnosis, otherwise it will look lab diagnosis, clinical features. Last I will tell you the virulence factor. In book you will first see the virulence factor and you will not understand anything. In Shastri it's written like this. I don't know about your new Shastri. So this is how it looks in, what agar is this? Blood agar. What else you can see? What are this? What are this? Colonies. What are this halo? Anybody? What are this yellow halo? It is looking yellowish, but what is this? Hemolysis. Who told it? Hemolysis. Very good. This is called hemolysis. What are the types of hemolysis? And not only alpha and beta, what else? Gamma and delta. Okay. So this is what type of hemolysis? Beta. What is alpha hemolysis? How does it look? Partially, and it will look green. Okay. And the most important one is the gamma hemolysis. Gamma hemolysis also looks like beta hemolysis. Okay. But the difference is, how does gamma hemolysis occur? So the bacteria has a hemolysin enzyme which has two parts, slow part and one is fast part. Along with that, they have a penton-valent toxin, PV toxin. So the action of, I am telling you point by point, whatever the questions will be asked in your Viva exam. Theory te ja khushi leg, Viva te ei jinishta jiggesh korbe, what is PV toxin, what is penton-valent toxin, ঠিক আছে? So how this gamma hemolysis occurs? Not only with the help of gamma hemolysin. Okay. To act gamma hemolysin, to act it needs PV toxin. Okay. These points you just remember. There are lots of things written in Shastri. which is we read it during our MD exam. That was enough for us. Shastrite onek point lekha ache. If you can read it, you can. But you can read it. If you can remember it, you can read it. But it will be too complicated for you. These points, if you remember it, it's enough. So gamma hemolysin, to act upon it, act upon any agar or any, to act it as a gamma hemolysin to act as a virulent factor, it needs help of PV toxin. Okay. So here what we can see, golden yellow colony surrounded by clear of zone of hemolysis, beta hemolysis, and when incubated, okay, this point is important. When incubated in sheep or rabbit blood agar in atmosphere, it shows the most effective result. Okay, here we use in practical class. I told you, some of you whoever is present in B batch, I told you we get human blood agar. We do not get sheep blood agar. But gamma hemolysis, beta hemolysis best দেখা যায় হচ্ছে sheep blood আগারে, ঠিক আছে? Human blood আগারে we can see it but rarely. Okay. Then next হচ্ছে in McConkey agar. McConkey agar যখন পড়িয়েছিলাম, what I told, it's a differential media. ঠিক আছে? কেন? Why? NLF and LLF, and তার সাথে what I told, it can differentiate between it can inhibit production of gram-positive bacteria, but it helps to, it sometimes, this is an exception. You can tell it that gram-positive bacteria cannot grow in McConkey agar, but in McConkey agar, why Staphylococcus grows? Because it can ferment sugar. Okay, it McConkey te ki sugar thake? Lactose. Okay, so lactose, it can ferment lactose. That's why in McConkey agar we see dry, pink, solid. These are the typical terminology which you have to use. In McConkey agar we see dry, pink, opaque, small, multiple colonies. Okay, round, glistening colonies. But dry, you have to mention. All gram-negative colonies, they give moist colonies. Gram-positive bacteria, they give dry colonies. Yeast, they give totally dry colony. Any candida species. Okay. Pink colored. Color also you have to mention. In a colony. They will give you a McConkey plate and they will tell you. Describe the colony structure of the colony features of this bacteria. Okay. So this is what? This is a selective media for Staph aureus. Okay. Mannitol salt agar. Okay. Mannitol salt agar দিয়ে কি differentiate করা যায়? It differentiate between Staphylococcus aureus and epidermidis. Staph epidermidis. Okay. Means cons. Cons means coagulase-negative Staphylococcus. We will be henceforth using this term for coagulase-negative. We'll call it cons. Okay. CONS. Okay. So mannitol salt agar is particularly used to differentiate Staphylococcus aureus. What are the other selective media? দেখ লুডলাম বলে লেখা আছে, বইটা খোলা আছে, বইতে লেখা আছে, দেখ লুডলাম মিল্ক আগার, ঠিক আছে? So these names you have to remember. Selective media for Staph aureus. Okay, this is also, if you can tell this one thing, that it is more than enough. Okay, so these are the biochemical tests. Catalase test positive, oxidase test negative. Oxidase test positive ke দেয়? Oxidase positive. Biochemical reaction discussion হয়নি practical class এ? একটা উইকে ডিসকাশন হয়নি biochemical reaction? B group হয়নি ডিসকাশন? আমি তো করাইনি, লাস্ট ক্লাসে হয়নি ডিসকাশন। ওকে, ভেরি গুড, হয়ে যাবে, ডোন্ট ওয়ারি। সো অক্সিডেজ টেস্ট পজিটিভ দেয় কে? আগের দিন বলেছিলাম, যদিও একটা শর্ট ইন্ট্রোডাকশন আমি দিয়েছিলাম। সিউডোমোনাস is oxidase positive. oxidase test positive. Okay, so this is oxidase negative. This is how we do catalase test. Ki kore ei je, this is how we do catalase test. Okay, what is that? That is a glucose broth or sugar broth, that yellow color. Okay, so I told the yellow colored thing in the tube. So Staphylococcus, it ferments. It ferments sugar and it produces gas. Okay. So there is the yellow color, there is an indicator, pH indicator. Once there is a fermentation of a sugar, there is a production of acid. So that the color will change into yellow color. Okay. These things are all looking like, for you it's like very vague thing, whatever I am telling. In biochemical reaction, I will show you each and everything one by one, so it will be very clear to you. Okay, and this is mannitol salt agar, this is Staphylococcus aureus, this is epidermidis. Both grew in this media, but there is no change of color because the indicator showed the change of the color after production of acid, after fermentation of mannitol. Okay. So these are the two types of test. Coagulase test I will teach you right now. Remember this thing, there are two types of coagulase. One is slide coagulase test, one is tube coagulase test. Staphylococcus has two kinds of, both are virulence factor. Okay. One is called slide clumping factor, which is present in, so Staphylococcus tube coagulase test, and one is slide coagulase test. Okay. This thing will be asked to you in your, let it be your theory exam or let it be your viva exam. Difference between what is the difference between slide coagulase and what is the difference between tube coagulase? Slide coagulase, from the name you can see, we do it in a slide. This picture, we do it in slide. Okay, and tube coagulase, we do it in tubes. Okay, in both the cases we need what? Plasma. What we see, if the bacteria coagulase, এই জিনিসগুলোর মানে কি, catalase, coagulase, এগুলো আমরা কেন নেই? To see if the bacteria has that enzyme. Okay, coagulase এনজাইমটা ব্যাকটেরিয়ার মধ্যে আছে কিনা। ওকে, তো স্লাইড কোয়াগুলেজ এর জন্য ব্যাকটেরিয়ার কোন পার্টটা ইজ ইম্পর্টেন্ট? দিস ইজ কল্ড ক্লাম্পিং ফ্যাক্টর। ঠিক আছে, clumping factor, which is also called bound coagulase. This thing is very easy to get confused, and tube coagulase is caused due to coagulase enzyme, which is also called free coagulase. Okay. So clumping factor is present on the cell membrane of a Staphylococcus. Okay, but actually, so if we ask you, coagulase test is positive because of what is the confirmatory test to demonstrate if a bacteria has a coagulase enzyme? You cannot tell the confirmatory test is a slide coagulase. It's tube coagulase. Why? By tube coagulase, we are demonstrating the presence of coagulase enzyme. And by slide coagulase, what we are demonstrating? If the bacteria has a clumping factor or not. Many bacteria can have the clumping factor or bound coagulase, membrane bound coagulase. Why it is called bound coagulase? It is membrane bound. Means on the membrane, cell wall membrane, it has the clumping factor. Okay. So বোঝা গেল এটা ডিফারেন্সটা। টিউব কোয়াগুলেস সিম্পল ফান্ডা, স্লাইডে করা হয়, টিউবে করা হয়। স্লাইড কোয়াগুলেসের জন্য বাউন্ড কোয়াগুলেস লাগে, which is membrane bound or called clumping factor, and ওটা টিউব কোয়াগুলেসের জন্য লাগে টিউব কোয়াগুলেস টেস্ট। এবার বায়োকেমিক্যাল টেস্ট যখন ক্লাস নেওয়া হবে, ক্লাসে একটা একটা করে টেস্ট দেখানো হবে কোনটা কিভাবে করা হয়। আই এম নট গোয়িং ইনটু দ্যাট ডিটেল রাইট নাও, ঠিক আছে? So another thing is important for you, it hydrolyzes gelatin. Gelatin, you know, first class I told you solidifying agent gelatin, agar and gelatin. First they were using gelatin, but solidifying agent, any liquid media to make it a solid media, first they started using gelatin, okay? But why they stopped using gelatin? Because it has a very low threshold for a high temperature. It get easily liquefied. So this gelatin can be hydrolyzed, means it becomes waterish, okay, by Staphylococcus. And another thing, these things you have to remember: phosphatase, DNase and coagulase-positive. Which tests are positive? These things, this is very tedious, I know, this is very tedious. Things you have to remember, okay, these things you have to mug up. Lab diagnosis এর এই পয়েন্ট গুলো খুব ইম্পর্টেন্ট। কোন ব্যাকটেরিয়া আজকে যাবি, go back to your room today, coagulase test, lab diagnosis, make a small chart, which biochemical reactions is positive and which is negative. Next day when you read streptococcus, you make another small a. If you read like this, then it will become, microbiology will become easier, ঠিক আছে? একটা স্মল চার্ট, একটা ছোট্ট টেবিল বানিয়ে রাখলি, ঘুরতে ঘুরতে জাস্ট একবার দেখে নিলি, আচ্ছা এটা পজিটিভ হয়, এটা পজিটিভ হয় না, দ্যাটস ইট, ওকে? সো দেখ, এটা একটা স্মল এ, আই উইল give this slide to you, give this PPT to you, okay? So this is the important part. এটা একটা 10 marks question আসতে পারে, ঠিক আছে? virulence factor. So what are the bound? Cellular, cell wall associated, okay? Cell wall associated, first হচ্ছে gram positive bacteria কি থাকে? peptidoglycan কি করে? it holds a structure. Peptidoglycan is thicker in gram positive bacteria rather than gram negative bacteria. Next is some of the strains they have capsule, I am leaving capsule. The important one is protein A. What does protein A do? এই protein A টা খুব ইম্পর্টেন্ট বাবা, একটু শুনে নে, এই জায়গাটা খুব ইম্পর্টেন্ট। চুপ করে যা, হয়ে গেছে, টাইম হয়ে গেছে, আমি জানি, টাইম এন্ডিং। protein A is very important. এগুলো সব স্ট্যাফিলোকক্কাস এর মেমব্রেনে থাকে, ঠিক আছে? ওয়াল মেমব্রেনে থাকে। এ কি করছে? protein A is coded by, so the bacterial genetics পড়ানো হচ্ছে, everything is coded by some kind of a gene. So protein A, which is present on the bacterial cell surface, ধর এখানে একটা protein A আছে, protein A cell membrane এর একটা component, মানে peptidoglycan layer, remember the cell wall structure, gram positive wall এর cell wall structure, তার মধ্যে there is a protein A for Staphylococcus. It is coded by a gene SPA. Every gene কি করে? ট্রান্সলেশন, চুপ, শেষ করতে দে, coded by gene SPA, okay? So this thing you have to remember. Now complement, you remember one, what is this end? You have to tell me what is this end and what is this end. What is this? FC. And what is this? FAB. Now complement class আমি বলেছিলাম FC region এ কি হয়? complement bind করে, okay? Why am I telling you this? This protein A, it gets, yeah, anti-complement. How this is anti-complement? That is what I am teaching you. FC region এ যখন, whenever a person gets infected by a staphylococcus, so your antibodies and the complement will start their own reaction, but there is a competitive inhibition. এগুলো তোরা 11-12 you have read this. Inhibitions. So there is a competitive inhibition of the complement. First complement which was supposed to get attached to Fc region. Instead of complement, the protein A goes and gets attached to the Fc region. That's why of the IgG. Okay. That's why the antibodies, they cannot react. This is how I told you, একটা bacteria, first আমাদের প্রত্যেকটা ব্যাকটেরিয়াতে we have to read like this. Virulence factor কি আছে? তাহলে এটার সবথেকে টাফ virulence factor হচ্ছে একটা তো পেপটিডোগ্লাইকেন রইলো, সবথেকে বড় ব্যাপার হচ্ছে প্রোটিনে। সেল ওয়ালে কি আছে? প্রোটিনে। প্রোটিনে কি করছে? এটা হলো virulence factor বললাম। Pathogenesis কি বললাম? It gets attached to, pathogenesis means how it is causing the disease. So it is preventing the opsonization by complement system. তাহলে this is the pathogenesis. এরপরে আমরা আসবো clinical features কি কি করে হয়। ল্যাব ডায়াগনোসিস পার্টটা আমি আগে বলে দিয়েছি যে কি ভাবে ডিফারেনশিয়েট করা যায়, ঠিক আছে। নেক্সট হচ্ছে টক্সিনস, কি টক্সিনস তৈরি করতে পারে। সেল ওয়াল দিয়ে হয়ে গেল, সেল ওয়ালে ভিরুলেন্স ফ্যাক্টর, পেপটিডোগ্লাইকেন, টিকোইক অ্যাসিড মেমব্রেন, টিকোইক অ্যাসিড ইন দ্য মেমব্রেন, প্রোটিন এ এন্ড ক্লাম্পিং ফ্যাক্টর, এগুলো অল আর কজিং। ক্লাম্পিং ফ্যাক্টর কি? বাউন্ড কোয়াগুলেজ, এটা এক্ষুনি বললাম স্লাইড কোয়াগুলেজ যেটা দিয়ে করা হয়, ঠিক আছে। What they cause? They all cause destruction of WBC, ঠিক আছে। They cause clumping of, this clumping factor causes clumping of WBCs. Okay, leukocidal activity means they kill leukocytes. Okay, so that extracellular toxins যেগুলো বের হচ্ছে, toxins এর মধ্যে কি আসছে? Hemolysin. Hemolysin also we first read hemolysis in the beta hemolysis and alpha hemolysis part. So hemolysis also occurs with the help of hemolysin enzyme. Okay. Next is leukocidin. Important one is enterotoxin. Enterotoxin is a preformed toxin. If we get a food poisoning after eating any kind of fruits, any kind of fridge kept or any kind of open cut fruits, anything, food poisoning within 1 to 6 hours, sudden vomiting, we have to suspect that we have got it from a Staphylococcus infection. Sudden food poisoning. Why? This preformed toxin in the Staphylococcus, it causes stimulation of the vagus nerve. Vagus nerve কোথায় থাকে? Vagus nerve supplies what? Anatomy. GI tract mainly সবার আগে কি করে? GI tract, full GI tract করে। তাহলে what will happen if we agitate the vagus nerve? There will be nausea, vomiting and loose motion. Okay, but if it's a Staphylococcus infection, it will subside by 10 to 12 hours. Until and unless that toxin, as because it's a preformed toxin, মানে ব্যাকটেরিয়াটা ঢোকার আগে, before the bacteria entered the body, it already had the enterotoxin. Inside the body, it doesn't produce any enterotoxin. তো যতক্ষণ না ওই টক্সিনটা accumulate মানে exertion হয়ে যাচ্ছে, ততক্ষণ you will be having that AGE, acute gastroenteritis. You will be having that food poisoning, clinical symptoms. Okay. Next is TST. What is this? Toxic shock syndrome. Toxin. What it cause? What happens with this? How it was found out? First, some people in America, they were some menstruating age group of some women of menstruating age group, they were using tampons. Okay, from tampons they started showing sudden shock like symptoms. Shock like symptoms means fever, sepsis like symptoms. Okay, fever, sudden hypotension, tachycardia, hypoglycemia, all those symptoms they were showing. So they found out that, and the patient came in a almost unconscious condition. And kidney failure, multi-organ failure. Okay. So, they found out the patient was using tampons. So, first it was found in tampons using menstruating women. Okay. After that, we have realized that it can produce this toxic shock syndrome toxin due to any reason. Okay. First it was found like this, I am coming to. Then another is exfoliating toxin. Exfoliating toxin, it causes 4S, Staphylococcus scalded skin lesion syndrome. Okay. I am showing you the pictures of it. I have explained you this. This is the exfoliative disease. The baby has got, see, the 4S, Staphylococcus skin scalded syndrome. Newborn babies, they show it most. Okay. There, what happens? There is a dissociation of the upper layer of the epidermis. Okay. There is first bullae formation, bullae or big blisters formation, and the upper layer, it goes, it comes out. Okay. In newborn childs. This is called SSSS, Staphylococcus skin scalded syndrome. When this syndrome becomes severe, it causes Ritter's syndrome. These things I am telling you, this will help you in your NEET or next exam also. ঠিক আছে, marrow পড়ছিস, marrow তে গিয়ে এগুলো পাবি। সবাই marrow পড়ছিস, you will get it in marrow. Okay. What is SSSS and what is Ritter's syndrome? Ritter's syndrome is a severe form of this thing, exfoliative toxin. ঠিক আছে? So, I am covering your syndromic approach also. The superficial infection caused by Staphylococcus. Okay. So, Ritter's syndrome ki hoy? Along with this, there is baby is feverish, stomach upset, baby, ar ki hoy? Lethargy and poor feeding. Baby is not eating. And if there is a lesser form, there is no scalded thing, this scalded syndrome, if it's in a severe form, it forms Ritter's syndrome. If it's in a lesser form, it forms one disease called bullous impetigo. It is nothing, bullae formation. Bullae means big blisters. ঠিক আছে, ছালটা ছাড়ানোর আগে অবধি লেসার ফর্মে হচ্ছে বুলাস ইম্পেটিগো, যখন গিয়ে পুরো ছাল ছেড়ে যাচ্ছে ওপরে তখন হচ্ছে স্ট্যাফিলোককাস স্ক্যালডেড স্কিন সিনড্রোম, যখন আরো সিভিয়ার হচ্ছে there is Ritter's syndrome. ওকে, সো নেক্সট ওয়ান, তাহলে virulence ফ্যাক্টর গুলো বোঝা গেল, and those are the enzymes. ওটা coagulase উপরে লেখা আছে, ওখানে হেডিংটা হবে enzymes. These are the enzyme mediated virulence factors. You have to memorize those names: lipase, phospholipase, hyaluronidase. They all cause same thing, proteolysis. বডির ভিতরে গিয়ে ডিফারেন্ট জায়গায় প্রোটিওলাইসিস করে। ঠিক আছে, এই যে virulence factor লাস্ট যেটা, এটা আমরা সিস্টেমিক পড়া শুরু করেছি। You will get it repeatedly for each and every bacteria. Okay, this things, this few enzymes, DNase, phosphatase, lipase. Okay, these enzymes, each and every bacteria, most of the bacteria, they have the same enzymes. Okay, so these things you do not need to protease. ঠিক আছে, these things you do not need to get worried about কি আমাদের এটা মনে করতে হচ্ছে। একটার জন্য মনে করলে you will be able to like remember it for other bacteria also. So these things I told you already. আমি এটা বলে দিয়েছি কি করে করে। ক্যাপসুল থাকলে কি, আচ্ছা, what is the action of a capsule? If there is a production, আমি একদিন বলেছিলাম ফার্স্ট ক্লাসে যখন দেখিয়েছিলাম প্লেট যারা ছিলি, if a colony is mucoid, I showed you a plate of Klebsiella, it was very mucoid. If you get, first I told you once when I was explaining the characteristics of a colony of a Staphylococcus, I told you it's dry. Imagine you are getting a mucoid colony, means there is a slimy layer, moist layer. you have to consider this Staphylococcus has a capsule. What capsule does? It forms biofilm. Okay, means this strain is more virulent. We got it here in central lab only. আমি যখন প্রথম জয়েন করেছিলাম তখনই দেখে পুরো মনে হচ্ছে ক্লেবশিয়েলার প্লেট, যখন স্টেন করা হয়েছে জিপিসি। Klebsiella is what? Gram negative. Klebsiella is very mucoid. ঠিক আছে, very Klebsiella gives very mucoid colony. But the Staphylococcus should give, আমরা প্লেট দেখলেই বুঝতে পারি it's a dry colony, it's a staphyl colony, it's a gram positive coccus colony. But it was so mucoid, means it's so virulent because it has capsule and it forms biofilm. Biofilm মানে এরা উপরে একটা slimy layer তৈরি করে, ঠিক আছে, so that any antibiotic cannot penetrate through that layer. That is how they are producing, that is how this virulence factor means the capsule causing the pathogenesis. So pathogenesis is what? Forming biofilm. Virulence factor is what? Capsule. Understood? And how they are causing? They are causing antimicrobial. What they are causing? They are causing antimicrobial resistance. They are preventing entering the any antimicrobial agent inside the cell. Okay. Protein এ আমি বলে দিয়েছি Fc region এ attach হয়, peptidoglycan thick layer হয়, সেই জন্য clumping factor also I told you plasma clump করতে সাহায্য করে, bound coagulation action. Same thing এখানেও আমি বলে, এগুলো সব I have already told you, just go through this slide once you go home and make a short note. ঠিক আছে, just points, remember the points. Exam যেদিনকে microbiology exam দিতে যাবি সেদিনকে পয়েন্ট গুলো ধরে ধরে এক্সপ্লেনেশন গুলো পড়বি। You are asking me repeatedly, ma'am কি করে পড়বো? This is the easiest way I can tell you. আজকে কি if you can make a short note, point by point, you do not need to mug up anything right now. Okay. So these things I told you. So these are the cutaneous infection, folliculitis, carbuncle, impetigo I told you, wound infections. What is this? This is folliculitis. Basically lomphora. Non-Bengalis, you are not understanding what is this? You ask your friends, if anybody is having it, tell them that you have got a staphylococcal infection. Okay. So another thing, what is happening? See, there is a sty. Staphylococcus can niche dekh ekta choke chobi ache. Anjani hole. Okay. Next is furuncle. Furuncle and carbuncle. From a folliculitis, that is called furuncle. If it's becoming more severe, that is called carbuncle. Carbuncle, when it becomes carbuncle, it needs IND, incision and drainage. Okay. You have to cut it and take out the pus. Okay. This is called impetigo, which I told. Bachatar mukhe dekh, there it started. I told the less severe form of Staphylococcus scalded skin syndrome. So bullous impetigo. The baby has started, peeling of skin has started, but not at all come out yet. Okay. So this is called impetigo. These are systemic infections, deep infections. Okay. When the infection is going deeper, the patient is not treated, but the patient is hospitalized or admitted. This will come in your hospital. Staphylococcus present in our hand. The most virulent Staphylococcus aureus, methicillin resistant Staphylococcus. If we take a swab from our hand and if we culture it over a plate, how many of you have seen Grey's Anatomy? Dr. Bailey, she had in her hand MRSA. Go and start watch, take from Arathrik and start watching Grey's Anatomy. You will get to see there one surgeon, because of one surgeon, 3 consecutive patients died. and only common factor between those three host of cases were one surgeon. So what she started taking swabs from her hand and she started culturing it and she saw MRSA and she developed one OCD, obsessive compulsive disorder, hand washing. Everywhere she went and she started washing after that case happened. So these things are important, I am telling you, because it helped me also during my MBBS class, because my college was also in a periphery rural area like this. Okay. So I used to watch Grey's Anatomy a lot. And I wanted to become a surgeon after seeing Grey's Anatomy. তোরা সবাই ভাবিস না যে Grey's Anatomy দেখলে সবাই surgeon হয়ে যাবে। ঠিক আছে? So if it causes a deeper infection, if it goes into bone, it causes osteomyelitis. ঠিক আছে? Osteomyelitis means কি হচ্ছে? Pain, swelling. It mainly happens in the knee and long bones. Okay? What else? Periostitis means, what is periosteum? কি হচ্ছে এত ইন্টারেস্টিং, এটা আমাকে দেখি যা। গ্রেস অ্যানাটমি দেখছি আমি, ওটার লিঙ্কটা বিকেলে দিয়ে দেবো বাবা, এখন একটু বলে নিতে দে। গ্রেস অ্যানাটমি খুলে দেখছে, ঠিক আছে। This is why this is important, endocarditis. I told you upcoming infections, emerging infections. Staph epidermidis, example of what? Coagulase-negative, cons, it comes under cons. Many of the patients who has undergone a valve replacement surgery, valve replacement means atrial valve or mitral valve. Imagine somebody has a regurgitation, the valve, atrial valve and the mitral valves are not working in a heart. They have undergone a valve replacement. Let it be a mechanical valve, let it be a pig valve, let it be a cow valve. Normally mechanical valves are getting used, and mechanical valve, if they use mechanical valve in a patient, these chances of getting bacterial endocarditis are very high. From where they get it? From mouth. Okay, from mouth. If you have a oral infection, okay, it can go from Streptococcus viridans and Staph epidermidis. You get bacterial endocarditis, and it is more common in patient who has already undergone valve replacement surgery. Okay. Next is this thing I told you. These are the symptoms of toxic shock syndrome. Okay. First is high fever, headache, vomiting, diarrhea, conjunctival reddening, blood pressure low, skin rashes. These are typical skin rashes, and kidney failure. Not only kidney failure is the first symptom of multi-organ failure, which is the severe most form of sepsis, bacterial sepsis. Okay. Next is Staphylococcus food poisoning. I told you enterotoxin mediated. হয়ে গেছে আজকে সব গিয়ে গ্রেস অ্যানাটমি দেখবে। Mode of transmission বলে দিয়েছি এগুলো। So these are the preventions. Hand washing, ঠিক আছে। Fridge stored food. I told you main enterotoxin production and enterotoxin are present in fridge রাখা food. What is the other bacteria which is present in fridge? আরে বাবা একটু চুপ কর। What is the other bacteria which can cause infection from eating eating foods directly from fridge? Bacillus cereus. Within এটা আমি বললাম it takes 1 to 6 hours. Bacillus cereus it takes 1 to 2 hours. Immediate infection হবে, ঠিক আছে, immediate vomiting. দেখ wound cover করে রাখতে বলছে, hand wash করতে বলছে, avoid sharing personal belongings, ঠিক আছে। এগুলো তো আমরা after COVID we have become more conscious with these things. Okay, so these are the these are the remedy. Okay, আমি হাঁপিয়ে যাচ্ছি যদি তোদের কথা বলার ছোটে. So what is happening? I told you IND if it's a impetigo, if it's a severe form, if it's a carbuncle, then it needs incision and drainage. So that is wound drainage, and after that there is antibiotic therapy. Drug, name one drug which is pharmacology পড়ানো হচ্ছে তো, specifically used for gram positive bacteria. Antimicrobial পড়ানো হয়নি এখনো. Okay, all of you know clindamycin, erythromycin, clindamycin, you know it. So vancomycin এখনো পড়িসনি, জানবি না vancomycin name. So I am telling you these names, okay? Clindamycin, vancomycin, these are the drug of choice of any gram positive bacterial infection, okay? And device removal. What is the device she has in her hand? Can you see? Very good. Who told? IOD. It's a copper T. So if a person has one intrauterine device for, let it be a Mirena, let it be, Mirena is, it's a hormone containing T-like T-shaped device. We just go inside and we just leave it in the uterus, and it slowly it releases progesterone. So this copper T, what is copper T? Copper T is a contraceptive device. So they all have an expiry date. Every 5 years a woman should change it. Normally কি হয়, গ্রামের দিকে কপার টি পরিয়ে দেওয়া হলো, ওরা ভুলে গেল, ওই ডিভাইসটা থেকে গেল. Okay, so this can cause symptoms like TSST. Okay, and removal of dead tissue. What is that? Necrotizing fasciitis, flesh-eating bacteria. That is mainly caused by Streptococcus, a very virulent strain of Streptococcus. A patient, if she or he comes with a necrotizing fasciitis, there is no other option apart from constant debridement, intraoperative debridement, until and unless that tissue comes negative for Staphylococcus or bacterial presence of any bacteria. আর যখন কাটতে ইন্ট্রাঅপারেটিভ ডেথ হয় মেনি পেশেন্টের, একটা জায়গাতে ছোট রেডনেস নিয়ে আসতে পারে পেশেন্ট. It's very difficult to diagnose, ঠিক আছে, this disease, but it's a deadly disease and life threatening. Patient কোথাও গেছে একটা ঘুরতে, you have to take a history, whether you have gone for a seaside travel বা you have went to a sea beach, কোথাও কোনো পেরেক দিয়ে ছোট কেটেছিল কিনা, কোথাও কোনো সি শেল দিয়ে ছোট কাট হয়েছিল কিনা সি বিচে গিয়ে, সেখান থেকে আস্তে আস্তে ফুলতে, this is also has been shown in Gray's Anatomy. It is also there in Gray's Anatomy. Okay, so don't concentrate on any other facts of Gray's Anatomy, concentrate on the medicine part. Okay, যারা দেখিস না তারা পরে বুঝতে পারবি. So these are the lab diagnosis. I told you there will be raise any infection, there is a raise of total leukocyte count, okay, and raise of neutrophils. Okay, these are the blood lab diagnosis. আগেই বলে দিয়েছি কি কি করতে হবে টেস্ট, কোয়াগুলেস টেস্ট, এগুলো ক্লাসে বলবো আমি কি করে করে. MRSA, methicillin resistant Staph aureus, ঠিক আছে. This is mediated by দুখানা জিন বললাম, protein A is coded by SPA gene, and methicillin resistant bacteria it is coded by MEC-A gene, MEC, small letter A, MEC. Okay, MEC-A gene. জেনেটিক্স এর আরেকটা ক্লাস বাকি আছে, ঠিক আছে. স্টিল আমি জাস্ট উইল ফিনিশ ইট উইথ ইট. কি করে পেনিসিলিন রেজিস্ট্যান্ট বা অক্সাসিলিন বা মেথিসিলিন রেজিস্ট্যান্স কি করে হয়? One bacteria, it has one staphylococcus, by any gram positive bacteria, it has a receptor on the bacterial cell wall, which is called penicillin binding protein. কে নেবে ক্লাস? কি আছে? তোদের ENT আছে? Okay. Okay, nothing. I'm just finishing it with the last thing. This penicillin binding protein, it changes. In case, this is how Staphylococcus, it encodes change, genetical change হচ্ছে এটাতে, this penicillin binding protein PBP gets changed into PBP1. There is a modification, so penicillin binding site is changing, and this change is mediated by MAKE-A gene. Okay, so this is how Staphylococcus aureus becomes methicillin resistant. Okay, cons, I have told you already. What are the cons?